Hello, my name is John Walter, and this is going to be my telehealth collaborative future project. Understanding telehealth. Telehealth as a whole delivers healthcare remotely to not only patients, but providers as well. This lets that anywhere in the world that you're able to make an appointment with your doctor. This is produced by using digital platforms and tools like your phone, laptop, and household essentials that can be made appointments and be used for Zoom calls. This improves access for patients and providers for being more time efficient for both parties and being able to do quick and efficient healthcare options. Rapid growth happened in the telehealth industry through COVID-19 due to the pandemic, forcing people to stay social distance and being at home. Right, key perspectives of telehealth. Right, providers deliver care. A key provider or the healthcare industry themselves, like doctors and the healthcare workers who deliver the healthcare system by being trained on the matter and being overall being able to let it be more efficient. Patients engage in the services. Patients like you and me engage in services like making appointments online and scheduling refills where you don't even need to see a doctor sometimes to get a medical refill. Right? And then policy regulation. Policies and regulation are regulated by the government to ensure that everyone has equal access to telehealth and how that it will take insurance policies, no matter what type of insurance you're on. And then the technology and business side. Right? Technology and business support systems and innovation. For technology, AI has been an important role in the telehealth atmosphere for the rapid growth and new development. For the business side, making telehealth not only regulated by the government, but letting private companies be able to invest in telehealth for the future growth and innovation has also helped to rapid growth. Right? The role each party plays or perspective plays. Right? The providers deliver and guide care. Providers' key role is not only to deliver care, but make sure everything goes efficiently and effectively as they have planned. And then patients play an active role in making their own appointments and ensuring that not only the providers provide for them, but ensuring that everything goes to plan and how overall it ideally will be more efficient. Policies are set up as standards and to regulate the whole system as a whole. Without policies, telehealth could be even more expensive than what it normally would cost to go in person, and there'd be no monitor to ensure that each telehealth provider is doing his best for the not only their company but for the patient themselves. And then technology and business drive innovation. As telehealth begins to grow even more and more companies are using telehealth, many will be driven to innovation for how they can make their product even better than their competitors, and which will overall lead to more profits for them and even better care for the patients like us. The impact of collaboration. This expands on, sorry about that. This expands across the field of when other medical providers, instead of being solo, as them all being under the same umbrella almost, you're able to collaborate with other ideas and see what works best and what doesn't work. This improves collaboration, will reduce overall cost of not only the cost of the medical providers, but the cost of the patients, how much they pay per appointment, and it enhances the quality of overall service. Interconnected and perspectives. Policy changes affect care and delivery. This could be that for each new policy added, it could be a more tedious process to overall help or decline the healthcare experience that the provider will have to go through the amount of loopholes to get to the patient. Technology improves patient experience by making it more efficient with the use of AI. For example, this would be to store files, handle appointments, and for more mundane tasks. While there are still problems with AI, like it's still not being able to always regulate the exact issue with the patient, but maybe one day in the future years, this will get there. And then providers influence trust in telehealth, which with telehealth, providers are expected to have somewhat trust in the telehealth system overall. With this meaning that for each new intervention added to telehealth, providers ideally will be trained on the matter and have a good, deep understanding of how it works and why it does. All perspectives are connected as a whole under an umbrella, which with each playing their own certain role to offer the best experience possible. The real world example. This comes from COVID-19 being the most vast one. Telehealth surged over 766% growth in only 3 months after the virus has hit worldwide. Healthcare service rapidly adapted, and then here's a photo representing that. And then 38 times telehealth utilization stabilized at levels higher before the pandemic. 57% of providers view telehealth more favorably than COVID-19, and then more, even more became after. And then telehealth takes on variants by specifically with higher potentials, right? And then the challenges of telehealth, not only now, but in the future. Telehealth accesses barriers. This could be firewalls, overall breaches, and hacks that could leak information, which has slowed the effect of growth, but it has not stopped it. User learning curve. The user learning curve is when, while someone may think to try telehealth, if it's not easily accessible and easily able to access, they might stop as a whole. This goes for not only the provider, but for the customer themselves, like the clients, where for me, example, when I tried it at first, I had a very hard time learning, but the more you use it, the more easy it is to learn. Policy roadblocks. Policies could affect healthcare providers for why they may be turned away by telehealth for being not worth the time or not worth the loopholes they would have to cross to get to the destination to use telehealth. Then ongoing expenses of telehealth. As telehealth continues to grow and only expands, the expenses for workers, overall services for technology and AI only continue to grow. And while ideally the profits from telehealth would continue to grow as well. And here's a chart of expected revenue for telehealth to grow through now through 2020, 2035. And then overall, here are all my references I used for my slideshow. And I want to say thank you for your time, and I love doing this class. Thank you so much.